Anticoagulation Therapy by Rowena Ann Bynum. Anticoagulation therapy is a course of drug therapy in which anticoagulant medications are administered to a patient to slow the rate at which the patient's blood clots. There are a number of reasons for a patient to be put on anticoagulant therapy, ranging from deep vein thrombosis to atrial fibrillation. A doctor must carefully carry a number of risks monitored for complications. As the drugs do not, they just inhibit the formation of clotting agents so that the blood cannot easily clot. One popular anticoagulant drug is warfarin, better known as Coumadin, administered by mouth. Although other drugs may be used, the injectable medications may be utilized in intravenous anticoagulant therapy. This treatment is used when a patient is at risk of health problems due to clots. In atrial fibrillation, for example, pooled blood in the heart can clot, which can be dangerous. In mechanical heart valve replacement, the body may form clots around the new valve because it views the valve as a threat, which puts the patient at risk. Patients with existing clots may be put on anticoagulant therapy to prevent the clotting from getting worse, as seen in pulmonary embolism and deep vein thrombosis. The doctor determines an appropriate dosage and puts the patient on a medication schedule, which keeps anticoagulant levels in the blood stable. Many drugs can interact dangerously with anticoagulants, making it important to talk to the patient about other drugs being used. Anticoagulation therapy guidelines vary by patient and situation, and the doctor must take care to confirm that the course of therapy is appropriate. Certain activities can also be dangerous for patients taking anticoagulants, making it wise to take a full patient history to learn about the patient's lifestyle and identify any risk factors which could complicate anticoagulant therapy. The big risk with any anticoagulation therapy is that the patient is more susceptible to bleeding. Patients bruise easily, bleed freely from even small cuts, and can be at risk of complications related to the fact that their blood has difficulty clotting. If a patient needs surgery, for example, the procedure can be very dangerous because of the lower clotting factors in the blood. Hence, a doctor has to carefully view risks and benefits with the patient to make sure it's being used and what type administered by mouth. Although other drugs may be used and injectable medications may be utilized in intravenous anticoagulant therapy. This treatment is used when a patient is at risk of health problems due to clots. 5 to 10 milligrams a day or loading dose must be monitored due to unpredictable and many drugs and dietary variation. There's 2 to 7 days to reach therapeutic anticoagulation. Begin with anticoagulant drug used to treat and prevent the formation of blood vessels. It is sometimes referred to as fractioned helium, is available in most countries by prescription owned by various trade names in different countries, according to manufacturer. Heparin sodium acts towards the end of the cascade. It inactivates thrombin, which is one of the chemicals involved in formation of fibrin, which makes clots. By inhibiting thrombin, heparin sodium prevents the formation of fibrin and therefore clotting. It is administered intravenously into the vein or subcutaneously under the skin. The dose and how often it is given is determined by what it's being used for and by each patient's response. This is usually measured by a blood test, the partial thromboplastin time, PTT. This basically measures how clotting and determines whether the dosage needs to be adjusted. Again, the laboratory monitoring would be the PTT.